If you are a nurse, a physician, a therapist, or any clinician feeling burned out on direct care, but passionate about improving patient outcomes at scale, you are not alone. In 2026, the demand for clinicians transitioning into AI-powered healthcare product management is exploding. Why? Because AI agents are transforming clinical workflows, predictive insights, precision medicine, and more. And companies need people who understand real patient care to build ethical and usable products. Today, I'm sharing my step-by-step guide to making this pivot based on mentoring dozens of clinicians into these high-impact roles. So stick around because this could be your path for more influence, better work-life balance, and a six-figure opportunity. First and foremost, let's look at why clinicians are perfectly positioned and why clinical expertise is gold. You know workflows, you know patient safety, regulatory realities, and stakeholder dynamics, things that no engineer or general product manager can fake. Now, layer on AI. Tools like genAI for documentation, agentic AI for autonomous tasks, and predictive models for outcomes are reshaping healthcare. Companies need product managers who can translate clinical pain points into AI features that can actually help providers and patients without really taking risks for safety or in ethics. From my experience launching AI-infused platforms, clinicians who pivot, they often rise fast because they bridge the clinical tech gap. And they bridge it better than anyone can. And the salaries, they're in the high 150 to 200 range, 200,000 range rather, in medtech, digital health, and pharma with way more strategic impact. So that might be something that's attractive to you. So let's look at a realistic no-fluff roadmap that I use with my mentees. Step number one is self-assess and reframe your experience, especially on your resume. Audit your clinical wins, stakeholder management, rounding with teams, problem solving under pressure, systems thinking, those patient journeys, data interpretation. These are product management superpowers. Reframe your resume by swapping things like you managed patient caseload for you led cross-functional care coordination across maybe 30 patients daily. You prioritized outcomes under constraints. Highlight any tech exposure, EHR optimization, telehealth pilots, quality improvement projects. Step number two, you want to build a foundational product management and AI knowledge. So if you don't have this type of knowledge, it's important to just understand the basics. Start by learning from free or low-cost resources, such as maybe reading Inspired by Marty Kagan, or watching product management YouTube channels like mine, and take short courses. There's courses on Udemy or Coursera for product basics. For AI healthcare focus, maybe learn key concepts like agentic AI, genAI in clinical documentation, ethical governance. I hold an AI product management certification. It's helpful, but it's not mandatory. Shadow maybe some product managers that might be at your hospital, especially if you have a digital innovation team, or join some healthcare, tech hackathons or side projects where they might be available. And get involved, even if you feel like you don't have the knowledge or experience, just go to learn. Step number three is create proof and network. So build a mini portfolio for yourself. Document a product case from your clinical world. Maybe something like how I'd redesign EHR alerts using AI to reduce alarm fatigue. Use free tools like Figma, or some mock-ups that you could even create in a PowerPoint slide, but make it visual because that can bring your resume and it also can bring your presentation when you're in the interview alive. Networking is so important for everyone, but LinkedIn outreach to healthcare product managers is a good opportunity to learn from them. Watch what they're posting or maybe reach out and ask for some opportunity to speak with them and just understand what they should focus on, not necessarily looking for a job, but getting some advice. You could join communities like many that are out there for in the product management space. You could attend HIMSS or virtual meetups. And just even, as I mentioned, asking for 15 minutes of just an informational chat, saying something like in a DM, as a clinician, I'm curious about becoming a product manager. I'd love for your advice in breaking in. Most people will help you, especially when you're not looking for, saying you're looking for a job and you don't know them and you're coming out of the blue. Some people are flattered that you've reached out or you're watching their content to get some advice in the space. Step number 4 is apply strategically and prep for interviews. So when you're ready, target those associate product management jobs or clinical product management or AI product roles at medtech companies or digital health companies. Your interviews expect behavioral types of scenarios. Most of them use something like the STAR method. Looking for that product sense. They're also looking for domain questions or domain answers about healthcare. So just wanting to know, where you are in the space, what you understand from regulations to ethics to products from a vendor side. And practice, some mock-ups. Focus on translating that clinical empathy and workflow, all of those great skills that you have, into product decisions. How does that all look? And step number 5 is land and level up. Once you're in, lean on your clinical lens to prioritize features that matter. Many clinicians accelerate to senior roles so fast because they deliver real value. Some of the biggest hurdles that I see are individuals that feel like they have imposter syndrome or resume gaps, or they fear starting over because they feel like it's a brand new type of work from being a clinician. And it is in a sense, but don't be afraid. There's so many opportunities and you're coming to a new role with a lot of experience that's needed. Although this role is technical, you don't need to code. Focus on user needs and strategy and what you would do for improvement of patients and the folks that serve them, right? Which was you if you were in a caregiver role. Your clinical insight is real value. Talk about the things that you would love to see in the different products that you may have the opportunity to represent. And a tip here is maybe start part-time. Do some maybe consulting on digital products while keeping your license and working your normal day job. Many people do this for maybe a year or two before the full transition, and it gives you time to learn if you actually enjoy it. And it also makes your resume more robust. So give that a shot. Maybe just put your toe in the water, do some consulting on the side, and see if it's something you like. I mean, you might start to do it and it might not be for you. You might love just where you are and that patient experience. So if this resonated and you're a clinician curious about AI-powered healthcare product management and can use some help, head to jenniferrist.com. I've mentored dozens through this exact pivot. Link in the description below and in the pinned comment. And if this helped, like, subscribe, follow me here, and drop a comment. What's your biggest question about this transition if you're a clinician? I'll reply or cover it in a future video. Thanks for watching. Your clinical expertise and AI is a powerful combination, and I know that you would be great at it. Let's build the future of healthcare together. We'll see you all in the next video.